Hi, everybody, and welcome to CVS Health Live, our ongoing series that delivers timely perspectives and insights on issues happening in healthcare right now. I'm Jessica Damasa. I'm a health innovation reporter, and today we are taking a deep dive into the data science and strategy behind behavior change marketing in healthcare. So we've pulled together a team of experts from CVS Health and Aetna who are going to give us some insider insight on how CVS Health is using data to help Aetna members adopt behavior change to improve their health. So this is a fun topic, and without further ado, let's meet our panel so we can jump right in. We have from Aetna the Executive Director of Behavior Change Marketing, Rahul Kek. We have Aetna's Vice President of Member Analytics, Laura Solomon. And from CVS Health, we have the Senior Director of Pharmacy Growth and Innovation, Lindsay Aubin. Thank you guys so much for being here today. We really look forward to talking to you about this.
Thanks for having us.
Thanks
for having us.
All right, we're going to start out with Raul because you have behavior change marketing in your title. So why don't you level set for us and tell us what that is for those who might not know.
Got it. Yeah. So I say this often in external settings. Behavior change marketing is probably the way we define it. It's most similar to population health management. So it is using marketing or other consumer engagement channels you'll hear about to nudge people on their path to better health. And so for us, this could come in the form of educational content and mailers, digital media, phone outreach, pharmacist discussions you'll hear about from Lindsay. In our case, it's often powered by predictive learning models. And I think for us, what makes the work challenging is that we're not just educating people about how to manage their own personal health. And so it's going beyond the scope of wellness, which is oftentimes about managing, body and mind, exercising and nutrition. For us, it's actually how do you interact with the healthcare system, which is really complex. So it's thinking about things like, where do I go for care? Am I getting the right treatments? And ultimately, what should I be talking to my doctor about?
A lot of people might bristle when they hear that about behavior change, especially, it's hard. It's a hard thing to do. People don't like to change stuff. So why is it so important in the context of health specifically?
Yeah, no one likes to be told to change. So despite, I think, what we've kind of described our program internally, it's not the framing we use because what we're actually doing is empowering people to make better decisions for themselves when they can themselves, or if not, talk to their doctor or clinician about their options. And what that's doing ultimately is shifting some of the burden of medical management away from payer and provider systems only to add some of that in the burden in the hands of the people. So it's more like kind of power to the people than just change. And so what's on us, our team, is to make that information digestible, relevant to those members, right place, right time, which is a mantra you hear from anyone who does modern marketing. And the reason it matters is because we have a national health crisis emergency in our hands. I'm not just talking about COVID, but it's just the state of the American health system and our access to health. You look at 60% of US adults have a chronic condition, 40% are multi-chronic, and the cost of healthcare is, don't really need to tell you about that. But, without getting into the rabbit hole of how we got there, what I'm excited about is we are ultimately empowering people to help navigate that and make better decisions for themselves, not only in how to be healthier, but how to access lower cost care.
All right. Laura, I'd like to bring you in the conversation here to talk a little bit about the data that you're using to do that, because that's the other side of this, right? So, especially at a time right now where people are very protective of their data and how it's being used, and there's a lot out there that might have some people not only unhappy about talking about change, but also unhappy about talking about using data to inspire that change. Tell me what kind of data you're using and what we're talking about here.
Sure. So we have lots of data, right, in our environments within CVS, mostly because we insure people. So we see all the claims data for our members. I would say that's our main source of information. We also see all the prescription data. So we know over time we are able to understand the type of conditions that our member may have. We understand their current situation in regards to how they're using their benefits, right? The access to care that they may have, which are the doctors that they are seeing on a regular basis, right? So I would say this is our main kind of data set is kind of that, medical history, utilization history, how they get care. And then we have additional data sets that are a bit more general data sets, like the demographic information. We have social determinant of health data. We have their clinical and their care plan type of data, if they're part of our care management type of programs. And we also have, to Rahul's point, we have their engagement data and preferences. So over time, I'm able to understand what's the right channel for this particular member. Like, do they prefer an email? Do they prefer a phone call, right? Do they prefer a pharmacist conversation? So we kind of bring all that data together to design those very targeted intervention to help members, right, navigate through the system and to stay on their right path to stay healthy.
Lindsay, jump in here, please, and explain a little bit. Laura touched on the pharmacist in this whole process here. So talk to me a little bit about what that looks like.
Definitely. So, from the data perspective, when Laura is looking at and identifying which patients might benefit most from a pharmacist interaction, she's actually then sending the data through our systems in the background, and then we're able to send down that targeted intervention to the patient's local pharmacy if they use a CVS pharmacy. And that's all happening in the background. So when it's presented to the pharmacy in the store, they're not going to see any of that medical claims data, right? We know that patients are trusting us with that data. We take that responsibility very seriously. The pharmacist will just have access to the normal prescription claims data that they naturally would have, and then they'll have on-screen talking points to really prompt them to have that conversation about whatever behavior change we're really looking to drive.
That's really cool. So tell me, can you give me an example, Lindsay, of how of a behavior change program so you can really kind of bring this whole concept to life?
Sure, definitely. So one that we're super proud of is our colorectal cancer screening kit program. And so that's a partnership. Rahul and Laura can certainly talk about the broader applications of that whole behavior change initiative, but there is a partnership that comes in with the retail pharmacy where we're able to use our large retail footprint to really prompt an intervention between a pharmacist and a patient when somebody is eligible for this screening. So colorectal cancer is the third leading cause of cancer-related deaths in the United States for men and women. And it's often one where early detection can be very important and impactful. But a lot of times patients don't know that they're eligible for a screening or they're hesitant for one reason or another. So as Laura described, she and her team use all of the data to identify which patients would benefit the most from an intervention and which patients would actually benefit from that pharmacist consultation. And then the pharmacist will be prompted, make an outreach, and then they'll leverage the trusted relationship that they have to talk to the patient about why screening for colorectal cancer is so important. And then we can also offer them a convenient option of an in-home kit. So in this intervention, the pharmacy team is talking to them about, again, why it's important to screen. And then if the patient's interested, we can arrange to have a kit sent directly to their home. So it's really convenient. It's taking a lot of that homework out of it for the patient and just making it a lot more simple for them.
Raul, talk more about the patient side of this, because that's really interesting. So it's like Lindsay took us out of the pharmacy now and into the home with the kit. So what is the patient's experience, an Aetna member? What does this look like to them if they're participating in a program like this or another one of the behavior change marketing programs?
I would say the intent is to just make it feel as seamless as it can with all of the other things that they're hearing from everyone from their providers, their payer, their care managers. What we try to do is integrate all of these touch points and create effectively a system of surround sound. So I'd mentioned some of the channels before, but I mean, you think of like emails, mailers, SMS, digital touch points like on a mobile app. And then you have the clinician discussions that are happening, with pharmacists or pharmacy techs. So I think it's like as much as possible, we'll try to group conversations in there. We'll try to have very personalized content that is modularizing these messages within other messages, right? So we are trying to be smart about focusing the communications when it's very relevant, and a lot of it just comes down to predicting sort of like what's the right time to reach someone, when is this most relevant. That's the work Laura's team is doing. But then also harmonizing all of these channels so they work in a sort of smart orchestration.
Laura, do you have anything that you'd like to add to that from the patient experience side when you're designing this on the back end?
Yeah, I think I want to emphasize a bit like the power of the data science behind this, right? Because one of the elements of differentiation here for behavior change is that we don't just broadcast, to all our members like the same message, right? So behind the scenes, we have teams of data scientists, hundreds of them, right, who actually predicts the members that are the most likely, to benefit from an intervention. So for the example of the colorectal cancer screening, we have a model that predicts the likelihood of a member to get their screening or not, right? Like, are they good with their health care, right? And like kind of tend to do those things, or are they very likely to not get their screenings? And so we basically divvy up the members in different kind of groups, and for each group we design then a personalized intervention with a different mix of channels that resonates for them. So in this case, the members that we predict are unlikely to do the screening on their own, we actually ship them a kit, and then we send reminders in emails, direct mail, to send it back to us. And then for the members that are kind of like in the middle, we actually encourage them to order the kit and return it back. And that's where the pharmacist conversation, comes into play. So those members are kind of on the fence. We don't have unlimited resources to send a kit to everybody, right? So what we do for them, we do a strong encouragement to order your kit, right? And then return it back to us. And that's where the pharmacist conversation is that kind of very unique, set up. Like one-to-one person, that's like the strongest channel that we have, because it's person to person, right? And the pharmacist can go into like an interesting conversation around the advantages of getting your screening. And then they can guide the member through how to order the kit and then how to return it. So it's actually quite powerful, and it's actually a very differentiated element of the offering. I think that's why we're kind of bringing together, right, Aetna and the CVS network. I think that's like a very element of differentiation of our combined companies to be able to do those unique programs.
No, and I agree with that totally. I think the power of that combination is pretty remarkable, because it goes all the way from deep inside healthcare all the way to the corner pharmacy, and then now into people's homes, and into their inboxes or SMS messages, as it might be. But Laura, I'm curious, like the overall goal for a program like this or one of the other behavior change marketing programs, what's the big goal that you guys are shooting for? What's the problem you're trying to solve, and why is it important for CVS Health to lead the way in this kind of thinking?
The key metric that we're trying to change is that member or patient behavior change. That's where the innovation is. Like, we go directly to the members, right, to the patients, to talk to them about things that they can actually decide, the elements of their healthcare where they have decisions that they can make, right, and choices that they can make. And so in the past, as an insurance company or a PBM, we would usually tend to talk more with like providers, right? Or we would, it would be the actual patient would be like more of an afterthought. But now here we go directly to the member, right? On topics that they can make decisions on, right? So that's kind of like the element of differentiation again. Now, I think what's also special about this is that we're hyper-targeted. So it's not like a mass enterprise wellness program where everybody gets their, incentive to go get their checkup. That would be kind of like more one-size-fits-all. Here we're able to really, using the data science and the personalized marketing, we're able to really deliver to each member exactly what they need. So we nudge them with very relevant information through the channels that resonates for them.
Well, I'll jump in here because I'm curious to hear how this is set up, because I'm sure you're very involved in architecting all of this. And so we've got a lot of different data sources. We've got different aspects of both Aetna, CVS involved. Laura touched on a lot of the different components of CVS Health, the PBM, the data, the claims data, all of that stuff. I mean, walk me through kind of, give us the insider insight on this. Like, who's involved? Where is this data coming from? The complexity is astounding. So it's like, what's the value in really looking at all of this?
Yeah. This is a loaded question. Let me start with kind of the history of it, where this came from. And, a few years ago when we started pulling together a program like this, and I think a lot of it is the recognition that behavior change is really hard. And then you take sort of companies in the legacy format, like Laura mentioned, are much more B2B rather than consumer oriented. And this idea of all companies now strive to be consumer obsessed. And it's difficult with the concept of behavior change. People are stubborn, they're set in their behaviors of how they manage their health, and society just makes it difficult to understand healthcare. It's just the system we're in. So we expect many of our efforts to nudge people are not going to work. So in order to concoct the right mix of channels, tactics, and targeted populations to trigger behavior change, we've recognized we have to be agile. So that's kind of a platform sort of need. And that means setting up a test and learn environment. So what we've done is we've organized, you've asked sort of like, how do we operationalize our team? So what we've done is we've organized many of our teams into cross-functional pods of people that as individuals represent the core disciplines that make that happen. So there's the data scientists, data engineers, there's creatives, marketing strategists, operations people, marketing technology, consumer insights. And what you're doing is you're taking these individuals and all with access to clinicians. And we've found that these horizontal teams that are held accountable to a portfolio of behavior change work, it's an effective way to turn over tests very quickly. And we're going to expect a segment of these tests to not work, but that's what we're testing for and optimizing. And in terms of what's the value of the data, you asked, I think we're using insight tools like dashboards. Every single test is going to have its own deep dive analysis, but also really importantly, we're trying to, and I think we have created a shared culture of learning and empowering people to operate as storytellers. So, it means using those dashboards and analyses and finding ways to share it back and propagate it across a very large organization and allow us to just iterate and make it better.
Laura, I understand that COVID had a lot to do with the way that the program was designed, and specifically, around the idea of, how do you reach people with the right kind of educational information at the right time for wherever we're at in our journey as far as COVID-19 is going. How have you guys been doing that? How have you guys been applying your model and the things that you've built here in terms of the way that your programs are designed to helping with changes specific to COVID-19?
Sure. So here's a great example where, the teams came together across data science and the agile marketing. We actually were able to very quickly put together an intervention for the COVID testing, right? So in just a few weeks, the data science team were able to score the members of their likelihood to get complication from COVID, right? Likelihood to get tested. So the members get kind of, scored that way. And then working with the marketing team to design an intervention. And, the recommendation for each member is COVID testing sites near them that we believe are more cost effective and high quality. So in a matter of 4 to 6 weeks, we were in market with this intervention that really, it benefits the member because they have more education on where to get tested, and it benefits us because we save a little bit on, the testing, and we send our members to high quality, low cost testing sites like CVS.
Lindsay, I want to bring you into the conversation here, and I want to ask specifically about people actually taking action, because I feel like the pharmacists, they're the front line, right? They're right there. And so how do you incentivize the folks that are the Aetna members, people, how do you get them to take action? And, how do you get people to understand the positive impact that those actions will make on their lives and their overall health and well-being?
Yeah, and I think Rahul said it earlier, we want to make it seamless for the patients, because I think when we're reaching out, this is something that the patient didn't necessarily ask for, and it's not top of mind for them. So we are keeping that in mind as we, the pharmacists, are sort of reaching out. We want to make sure we're educating them on the importance, but really we think, the channel of having that pharmacist-patient relationship, we can use that to drive more change, because we can actually get at the members' personal barrier. And then we can help them solve it. We can make it seamless for them. So whether it's education, understanding why it's important, that'll help them understand what the action will be after they take it, or what the benefit might be. Also, patients who have regular health needs like labs or imaging, we can offer them a more convenient site or a site that's more cost effective for them. So really just trying to have that conversation and then personalizing the solution for them based on whatever barrier it is. I think that makes it easier for the patient to then take the action that we want them to take.
Raul, what's next for this program? Because this, I understand, is something you can kind of build it and then apply it to a number of different areas. So we've already touched on colorectal cancer screening. We've talked about COVID-19 testing. So, what's ahead? Give us a sense of what's coming down the pike.
We are very excited about productizing this and bringing this behavior change capability to more employers and health plans that may not have the scale that we do as a company within CVS Health to build their own in-house behavior change department. So all of the functions that, Lindsay, Laura, and I represent, and numerous other individuals and hundreds of people, not every health plan has that. So to the extent that we're able to offer that as a buy-up for other programs and, selling that, either through Aetna or through Caremark or through, payer-agnostic channels, I think that's really cool. I'm going to give you one more area that I'm excited about, and this is from a population standpoint. I'm excited to work more deeply on Medicaid-specific applications, which is, it's even harder to change those behaviors, and health is not often at the top of the list. You talk about social determinants of health. In Medicaid, it's the largest payer program in the country. It's bigger than Medicare, and with COVID, you're seeing more people migrate into Medicaid. I think with the Biden administration, you're going to see probably eligibility expansion across more states. And I'm excited to just get smarter in cracking that nut of empowering these types of members to manage their health better.
All right, Lindsay, what about you? If you're going to talk about what's next or what you're hoping for and how this ends up in CVS Health pharmacies all over, what would you add?
Yeah, I would just say, let's think about how we can leverage our retail footprint even more. So I think we have some great opportunities. To hear Rahul talk about Medicaid, I think just the fact that we have over 9,800 stores and we are sort of the front line of healthcare, it's just how can we continue to have those more clinical interventions where a pharmacist can make a difference.
All right, Laura, close it out for us. Let's hear about what you're excited about next. And also, if you can tell us where people, specifically maybe those employers that Raul mentioned, where they can find out more information about how to set up a behavior change marketing program. If you can tell us where that information might be, that would also be very helpful.
Sure. I'm personally excited about, the constant evolution, right, of data science, right, as a field, which behind the scenes powers a lot of this program. And so as we become smarter as data scientists and we bring in more data sets, right, and better techniques, we're able to make the interventions even more powerful, right? We're able to expand our range of topics, right? We're able to be more targeted, adding channels, those sort of things. And so for me, I think that's what's exciting is the data and technical aspect of it underneath. And obviously always the ability to activate the CVS stores over time, right? So we started with the pharmacist, but now we also have the health hubs, right? And the mini clinics and all of that transformation that's happening within the health hubs, and also bringing that into the fold and using that as a differentiated way to help our members and patients.
All right, Laura, thank you so much. For more information on these behavior change marketing programs, you can check out Aetna's website. That is www.aetna.com/services/care-management. You can find out all of the info there so you can figure out how to bring one of these into the population that you manage. To our panelists, thank you so much for sharing your insight with us. We love hearing what's happening inside CVS Health and Aetna. Raul, Laura, and Lindsay, thank you so much for joining us. And for everybody else, thank you so much for joining us here on CVS Health Live. We'll see you next time. Take care.